you and Varun, FICCI team, for having us all here. And I must say the first two were absolutely fantastic, very inspired hearing the legends and the torchbearers. So you're right, I grew up definitely seeing healthcare very up close and personal with my dad building this over the last 40 years. So when you ask about universal health, and when we are talking about Viksit Bharat and the vision for 2047, it's a big goal, right? And it's a big goal when we're talking about universal health coverage for 1.5 billion people. And so many things have changed across the globe that make that how do we stay relevant? I think India is in the world map when it comes to healthcare right now. No doubt about it. When people talk about healthcare, when they talk about quality healthcare, when they talk about healthcare equity, also to the largest extent with the Ayushman Bharat, India is there right at the forefront. I completely you spoke about whether India is up there with the Mayos and the Clevelands and some of the global best. Absolutely. I think we are definitely there in terms of doing it at scale, as well as when it comes to tertiary and quaternary care. I think what we need to be focusing on, and when you asked about my vision and our vision, when we think about what the world needs now, it is the shift from episodic care to integrated care. And I think this is a really important pivotal shift. I've seen, at least at Aster, we have built strong building blocks, at least in the Middle East, on primary care. If you are able to make your primary care as a foundation, as a backbone, and make it very strong, the requirements and the dependencies and the need for very advanced care in the tertiary quaternary gets reduced. That burden gets significantly reduced. And the reality is, when you look at the demographics of the world around us right now, with the lifestyle diseases that all of us are talking about, people having diabetes, hypertension, obesities, 30s, 40s, I mean, you're talking about spending half your life with these diseases. Who wants to live to 80, 90, 100 being burdened with all of this? So it becomes really hard for us, like Sangeeta was saying earlier in the previous session, we should be able to catch all of this much earlier. Nobody should have to go at 40 or 50 to find out about 3 blocks. It can happen much quicker. Now, how do you sort of embed it into the healthcare system? That can only happen with primary care. We need to have the primary care set up so strong, whether it is from the school, whether it's the public health systems, whether it is the healthcare provider. I think getting that, using digital, using the mobiles, using sort of building up that the base of the pyramid with primary care is the one that's going to help us transform healthcare. And I think another thing I would really like to focus on, and I think it's important for all of us to have the dialogue on, are on all the new things that our generation and the next generation have to deal with, whether it is mental health, whether it is the aging population and what that means for us as a community and as a population. I think these require us to shift our focus on care very differently. It's great to talk about doing all the wonderful work on cardiac, all the great work in oncology, whether it's liver disease, right? But really, when you're talking about mental health, when you're talking about having powerful tools like the mobile, what about all the issues that comes with this, whether it's addiction, all of those tech addictions, things like that are ones which are very important. So for me, the biggest shift I see is we've got the power of the people. I think we have great healthcare fraternity. Weaponizing it sounds interesting, like what Ade was saying, but the truth is that's the power of the Indian mind. And we're so powerful as a nation, and if we are able to combine that with what the ABA is doing with the digital infrastructure, that is where true healthcare equity will come in.